Hi everyone, this is Dr. James Fang. In today's video, we're going to talk about scoliosis and pain. More specifically, pain in adult scoliosis. So why do we discuss adult scoliosis only? Well, that's because pain is less common in children with scoliosis and more common in adult scoliosis. So as kids get older, become young adults, then they may start to experience some of this pain, and they may continue to experience that later in life. And I have many patients, when they first came in as a young adult, they had the back pains for a long time but did not know why, until we have an x-ray done and realize, hey, you have a scoliosis, and often they're quite shocked and do not realize that they have had scoliosis for a long time. So the patient asked me, "Doctor, my curve is bad. Does it mean that I'm going to have this pain for the rest of my life?" So to answer the questions, we need to know what are the two reliable predictors for pain in adult scoliosis. So many people will think that the bigger my curve, the bigger the pain that I have, or the more pain I have. But that is not a predictor. Look at both sides of the curve. Now, the size of the curve can be a predictor for future progressions, but not for pains. So what are the predictors for pains? First one is actually our sagittal profile or sagittal posture. That means that you look at a person posture from the side view. Okay? Is the head over the shoulder? Is the gravitational lines in alignment? If it is, then you're less likely to have pain. If it's not, then you're more likely to have pain. So our sagittal to side posture is actually a better predictor for our pain. And second thing is that about adult scoliosis is, when do you have your scoliosis? When do you develop that? If you have developed your scoliosis as a kid, then likelihood is a little bit less, versus if you have developed scoliosis because of degeneration. So that will give you a higher likelihood to experiencing pain in adult scoliosis because of the degeneration. So for our adult scoliosis patients, we're going to want to focus on two things. Number one, we want to improve the sagittal profile or side posture like this. Why? Because we know that that is a reliable predictor of pain for adult scoliosis patients. Second, we're going to show them how to do the scoliosis exercises that is tailored to them, and that will help to stabilize the spine and prevent further degeneration.